Hi, Sarah MacArthur here, a day late and modifying how we're going to do things because, well, clearly I need to go this way. This is a new system and it's not YouTube because I couldn't make YouTube show me the camera. Um, and I need to open up that document that I created yesterday while I was getting ready to talk. Thanks for anybody that's watching. It's been 6 hours worth of screwing around with my computer. So that's been fun. Okay. I am here to talk to you about Project 2025. And interestingly enough, Representative Crockett from Texas, she's a lawyer, actually interviewed somebody that was one of the contributors to this book at a congressional hearing. And she basically told them, you can find it on YouTube. She basically said, this is a slide into authoritarianism and fascism. And she wouldn't be wrong. She would not be wrong. So I had promised at the last interview to talk to you about intersectionality and what does that mean. And I'm happy to do it. I'm still trying to figure out a good place to be or not be or whatever. Oh, there's a highlighter. Yay. And I said I would get you the definition of intersectionality because it was so such an odd word. And it's kind of a new in our lexicon of words. So it means the interconnected nature of social categorizations, such as classifying people with their race, their class, their gender, or transgender, or cis, or those kinds of things. So that's happening, and then it's when you classify and categorize people in that way, and you apply it to a given group or an individual. Then it's regarded as creating overlapping and interdependent systems of discrimination or disadvantage. So intersectionality, I guess, is really saying that there are people in our country, in our world, that are not being treated fairly, that have not been, how I can get this to move me. I want to be in the middle of the picture. I absolutely don't know how to do that. Oh my God. Like, yes. Trying to move this damn thing. Oh, yeah. Still, I guess I have to move. Of course. I didn't realize how much trouble it's going to be when I started. There we go. Yay. I think I'm still recording. Okay. Anyway. Then for people that don't know what woke is, I mean, there's the derogatory definition of woke. That woke is very mean-spirited by the conservative, GOP, great grand old party of the Republicans, and they don't like people being woke because being woke means that you're compassionate or you care about others or that you think that people ought to be treated equally, that kind of stuff. So it means that you're aware of and actively attentive to important societal facts and issues. That's what Democrats think of being woke as, and that's not incorrect. Couple of points that I wanted to make before I get into the actual chapter, which is the Health and Human Services, where it's near and dear to my heart because I've always worked for the Health and Human Services Department, and I retired from the state of New Mexico, having worked for them. Katie Britt, another representative or senator, I'm not sure which one she is, but she's in Congress. She's the one that gave the speech after the president's State of the Union, and she gave the rebuttal to the State of the Union. And she got a lot of flack for that because she was sitting in a kitchen and just had some odd things to say. It was very strange. But just here in the last couple of days, I guess, she introduced a bill to create a pregnancy registry nationally. And I think we can all agree that that's not a good thing. Basically, you're tracking a person's pregnancy, and what if they have a miscarriage, or they need to get, a DNC, or there's just so many varieties of ways that this is a bad thing to do for somebody. So sorry, I'm moving around so much. So, that is happening. It's more imperative now than ever that we vote Democrat, that we vote, that the masses come out, and that women come out, because we are being slowly but surely pushed back into the dark ages. Women should have the right to make medical decisions on her own, with her husband perhaps, or with her family, or on her own, whichever she chooses. But she is having those rights taken away. The first step was with the conservative Supreme Court taking away Roe versus Wade. And since that time, they've taken away a bunch of other things. And there are a number of cases up, that have been up in front of them that indicate that they are not at all interested in following the rule of law, or they're not at all interested in, our country being advantageous to the masses. They want to only take care of certain groups of people, and women are not one of them. So you need to know that happened. So what we have here, and I am stealing this, I'm stealing this quote, and it came from Ali Velshi. He was doing a program for Lawrence O'Donnell on MSNBC. And he said this about this book. He said, what we have in this country, just a mere 187 days away until the election is not hair on fire speculation about what Donald Trump might do if he's reelected. What we have in this country is an 887-page roadmap, literally call it Project 2025, detailing the exact plan to transfer an astonishing amount of power to the president if Donald John Trump is reelected. As the New York Times opinion writer Carlos Lozado wrote, it portrays the president as the personal embodiment to popular will. It treats the law as an impediment to conservative governance and elevates the role of religious beliefs in governmental affairs and regards the powers of Congress and the judiciary with dismissiveness. End quote. So Project 2025 is a vision for the second Trump term that would be anathema to our founding fathers. And if you want an example of when laws are optional and presidents are free to act with immunity, just look at Russia. So I'm going to stop the rest of that segment that he went into and spent a lot of time talking about the 5-term President Putin. And even though he just recently had the 5th-term election, it wasn't much of an election since he jails all of his opposition. So that's what we can look forward to. And that is what these people are calling this book. And I want you to know that they're not far off from that. Okay. So one of the things I want to tell you about in reading this book is, as you read it, you will discover that it is an incestuous little group of people. So it's not the millions and millions of people and this millions of supporting documentation that supports that. What you have is you have all of these contributors, and what the contributors have done. Here we go. What they have done. We have authors, and then we have contributors. In contributors, there's 1, 2, 3, 4, 5, 6, 7 pages of contributors. And I kind of touched on that they're all within these groups: Texas Public Policy, Alliance Defending Freedom, Center for Immigration Studies. They're all conservative think tanks and things of that nature. And they all work together. And what's funny about the footnotes is that when you actually go and start reading the footnotes, you realize, oh, this footnote was published because it was published by another contributor or another person that works at one of these think tanks or the Heritage Foundation's newsletter. And it's been published over the last several years or 8 years or whatever it is to accommodate their belief system. And now they're using this book to cite the things that they wrote that are of opinion basis and not necessarily always factual. So Again, this is all hyperbole, and it is designed to, I actually can't believe that they put all this in writing. I think it's kind of bizarre. Mm. So, um, all I would say is let's get started on Department of Health and Human Services, written by or authored by Roger Severno, who it turns out I have written down about him somewhere. Now that I said that, I'm so sorry. So sorry. Oh, I'm no, I'm not on it. What did I do with that button? Are you serious? Are you kidding? Oh, there it is. Oh, sorry. Sorry. He is a vice president of domestic policy at the Heritage Foundation. And I'm just going to start asking you to go and look up Heritage Foundation and see who funds that. It's a billionaire. So what he said was the Health and Human Services impacts the lives of more Americans than any other agency. And that's possibly true. And then they have 11 operating divisions within it and 15 staff divisions made underneath the office of the secretary. They did not discuss every single one of those divisions, but they did make a good hefty effort to do that. The statements here are just crazy. So they have different goals. There's goal 1 through 5 in this chapter for Health and Human Services. Goal 1, protecting life, conscience, and bodily integrity. So it's the last sentence in the second paragraph says abortion and euthanasia are not health care, which is an opinion. It says a robust and respect for the sacred rights of conscience, both at Health and Human Services and among governments and institutions funded by it, increases choice for patients and program beneficiaries, furthers pluralism and tolerance. Did we look at pluralism? You can't remember, but I thought it was pretty bad. The secretary must protect Americans' civil rights by ensuring that the Health and Human Services programs and activities follow the letter and spirit of not the law, but religious freedom. So they're basically taking out any need for following the law, and they're translating it into Christian nationalists. So if you don't believe like they do, then you're on the wrong side of that. The next secretary must ensure that the programs protect children's minds and bodies, and that programs respect parents' basic right to direct the upbringing, education, and care of their children. Why we're doing that now. We do that now. Why would we not do that? We respect their rights. But here's the thing, is if you're really intent on protecting children, maybe you ought to come up with some gun laws, because so many of those children are, so many students in schools are getting shot, and in any other location nowadays, but they're not interested in protecting anybody past birth. It's at inception all the way to birth, and then when you're born, you're on your own. You can go hang. And from what it seems like from the rest of the stuff that I'm going to talk about today, they don't really want to keep those programs that help people and help families that are on the lower income side of things healthy, and with insurance and with food. So it's not a good thing. Second goal, empowering patient choices and provider autonomy. Patient-centered and market-based health should empower individuals to control their own healthcare-related dollars and decisions. Well, I happen to know a lot of people and clients that I had, and they're not capable of doing that for themselves. I mean, it's a payer system, but they can't direct how that money goes. It's never a good thing. Don't give someone a lump of money and say, okay, now, once it's gone, you're on your own and you don't have any more money. That's not going to work, I don't think. Empowering patients. Goal 3, promoting stable and flourishing married families. It ignores people's rights. It's saying these policy, it says, family policies under President Biden's HHS are fraught with agenda items focusing on LGBTQ and equity, subsidizing single motherhood, de-incentivizing work, and penalizing marriage. I don't see those things happening, but these policies should be repealed and replaced by policies that support the formation of stable married nuclear families. And that's the envision. That's what they want to envision. So, goal 4, preparing for the next healthcare emergency, and this is a tangent on COVID and how it's not up to the experts that work for the administration to discuss or figure out when we should have a lockdown or how extreme the lockdown should be, because they don't consider a health directive the law, and when you don't do that, then you basically end up where we ended up with over 1 million people killed from COVID, the only industrialized nation to have that happen. Every one of the overreaching policies during the pandemic, from lockdowns and school closures to mask and vaccine mandates or passports, received its supposed legal justification from the state of emergency declared and renewed by the Health and Human Services Secretary. It wasn't supposed legal justification. It was real justification, and it came about at the first pandemic back in the early 1900s was when they actually created that law. And Congress voted for it. For the sake of democratic accountability, we must know with clarity what will trigger the next emergency declaration, and just as important, what will trigger its end. And it's so funny because they're talking about how all these excessive deaths and being forced to be locked down, and they're blaming it on Biden. They're basically making it seem like this is a Democratic problem and the Democrats did that. But it seems to me that it was President Trump that was in office during the pandemic, and he is the one who actually removed the infectious disease unit that would have been able to respond to this crisis sooner and faster and more immediately. And it was Trump's family that did that, and Trump's administration. Public health bureaucrats shouldn't be allowed to hide behind information or ignore it or mislead the public concerning the efficacy or dangers associated with any recommended health interventions. Again, it was Trump who did all of that. It wasn't anybody else. And his staff, the people that came to the briefings, the daily briefings, were mortified when he was, basically downplaying the pandemic and acting as though it wasn't really a big deal. And so we're going to get a grip on it really quickly and all that, knowing that he wasn't, and admitting later after he's out of office that, yeah, he knew it was really, really bad, but he didn't want to give anybody anything to think negatively about himself. Goal number 5, instituting greater transparency, accountability, and oversight. There's one, it says, we must shut down and lock the revolving door between government and big pharma. Regulators should have a long cooling off period on their contracts, 15 years, that prevents them from working for companies they have regulated. I'm not going to argue with that because, there is some element of lobbyists and Congress people and going back and forth and kind of, not really paying attention to what the American public's majority of people say in each state. Instead, what they're saying is, those people actually interact and make laws that benefit big pharma or big companies. Pharmaceutical company executives should be restricted from moving from industry into positions within regulatory agencies. We had that with the Department of Defense. We put somebody that worked at, I can't remember the name of the company, Rayon or something. He was a defense contractor, and they made him the secretary of the Army, or not the Army, but the head guy in charge of all of our armed forces. And he was somebody that got paid to build things for us. They call the Center for Disease Control and Prevention the most incompetent and arrogant agency in the federal government. They want them split into two separate entities housing its two distinct functions. On the one, CDC is responsible for collecting, synthesizing, and publishing epidemiological data from the individual states. I actually had that happen here, and Dylan and I got paid to go and get the most thorough physical I've ever seen in my life when they came to Chaves County. And then they have another role, and that is they're supposed to collect data about things and then report on it. And in this, they did fall down, but that's not what I'm really focused on, because underneath the Center for Disease Control, they have a sentence that really leaps off the page that says, we need to determine what the proper balance of lives saved versus souls saved is. Can I read that again? What is the proper balance of lives saved versus souls saved? So I guess what I'm reading there is that it's okay for people to die as long as they believe in Christianity, or the right wing's form of Christianity. That's pretty damn scary. I'm going to move on to this is all related to CDC data collection. And then they start talking about respect for life and conscience. The CDC should eliminate programs and projects that do not respect human life and conscious rights and that undermine family formation. It should ensure it is not promoting abortion as health care. It should fund studies into the risks and complications of abortion and ensure that it corrects and does not promote misinformation regarding the comparative health and psychological benefits of childbirth versus the health and psychological risks of intentionally taking a human life through abortion. That is their view, and they are sticking to it. They also say here, liberal states have now become sanctuaries for abortion tourism. And they've created that problem by not allowing women to have abortions in predominantly red states. Yeah. They want to force the states to report exactly how many abortions take place within its borders, at what gestational age of the child, and for what reason. The mother's state of residence. In other words, we're going to prosecute people who cross over from one state to another in order to get that type of health care. And by what method they had an abortion. So when we say they're going to control you, we really mean it. CDC should end immediately its collection of data on gender identity, which legitimizes the unscientific notion that men can become women and vice versa, and encourages the phenomena of ever-multiplying subjective identities. Okay. Food and Drug Administration, they're really going hard and heavy after abortion pills, and they blame Medicare having negotiated with the administration and having, again, the second part of that was during the Infrastructure Act, Biden passed so that like insulin is only going to be $35 a month, period. It doesn't even cost that much to make. So these whole astronomical amounts of money that they are spending on drugs, they want to, what this book says is, because this is negotiated, it's creating drug shortages. I'm so sorry. I'm so tired. I've been trying to figure out this computer for days. Okay. What they want the Food and Drug Administration to do is to reverse its approval of chemical abortion drugs, because the politicized approval process was illegal from the start. Except for that it wasn't, because it actually went through the FDA and it went through a bunch of lawsuits. And so now they're going to use what's called the Comstat Act of 18 something. It was like back in the 1800s, so that pills can't be mailed, and not just abortion pills, but all kinds of pills. And so they want to implement adverse events reporting systems for any kind of thing that happens like this. They want people in the hospitals to report on complications from abortions. And did they take Mifeprex or the other one, whatever the other drug is called? They want them to stop it. And then they want to also implement a policy of transparency about inspections of the abortion pill sponsors. So Danco and Gen BioPro, as well as facilities that manufacture the pills. In other words, the government's going to actually step forward and come into your home and stay there. I'm moving on from there. It's just, there's nothing nice to say about it. The National Institute of Health, they didn't leave them out. They want to do bioethics reform. And so one of the things I want to point out to you is end intramural research projects using tissue from aborted children within the NIH. They don't do that now. I mean, there might be some states that do a little bit of it, but when they talk about using intramural cells, they're acting as though they just went and took it right out of the room the woman got an abortion in and took that fetus and took its cells. And the truth is, they're from the 70s and the 80s from abortion spectrum, and that they've been creating them and regrowing and creating in test tubes and petri dishes the cells that they got from 40 and 50 years ago. So it's not like they're actually going out and getting more fetus cells on a regular basis in such a large quantity. They aren't. And, I've had to really suck it up and learn a lot of this stuff. They also talk about because everybody has a right to a mother and a father, the 3-parent embryo creation and human cloning research has to be banned. It's been banned since 2019. It's already banned. We don't do it. There might be, I think that they have successfully done that in England and New Zealand, but we don't do that here anyway. So them acting as though this is a huge problem, it's not. It's not a huge problem. They're just not telling you the rest of the story. And it drives me nuts. Okay. So then they talked in relation to the NIH, they talked about the conflict of Anthony Fauci and Fauci's deputy director, Clifford Lane, having ownership rights, and that they ended up getting royalties from Moderna. I think it was Moderna, and on the COVID thing. Should they have? I don't know. I mean, but until you straighten up the fact that they're doing insider trading in Congress, and until you straighten up the fact that big, huge donations are fine for SCOTUS, somebody that actually did work and did the research and actually helped contribute to solving the COVID problem, I'm probably going to say he can get paid for that, And if he used his own money to do so, then he has every right to that, Centers for Medicare and Medicaid Services. Medicare should be reformed according to 4 goals and principles. Increase Medicare beneficiaries' control of their health care. In other words, we're going to let you pick and choose what you want, and then we'll give you a set amount of money. And then if, you just don't get it. They also want to put caps on spending. Back to caps, back to pre-existing conditions, back to things where they're not going to help the person. They're actually hurting them. Reduce regulatory burdens on doctors. Oh, well, so doctors should just willy-nilly be able to. Now, I do think that their coding system is vast, difficult, and they have to hire specialized people to be able to do it. Does it need reform? Yes, it does. Does it need you to wipe away all of the information so that doctors can just put whatever they want in? I don't think that's doable either. Doctors must be free to focus on treating patients first, not entering codes on computers, and should not be tempted to change their medical judgment based on arbitrary or illogical reimbursement incentives. Doctors don't enter codes into the computer. Staff do. So they do sometimes have to readjust what the prescription is that they've given you. They do sometimes have to adjust a treatment plan or a testing plan because their insurance company at this point won't pay for it, but it's not generally Medicare. Ensure sustainability and value of beneficiaries and taxpayers. Prices are best for patients when determined by economic value rather than political power, and when they are known in advance of the receipt of the services. I would like to know how much my things cost. They should be the same at every hospital, but they're not. Um, Regulatory reforms. They want to have coverage of innovative technologies rule, risk adjustment data validation rule, the Medicare Advantage qualifying payment arrangement incentive, and the global and professional direct contracting, rebranded as the Accountable Care Organization Realizing Equity, Access, and Community Health. Okay. I don't actually disagree with that. So it says whether you get that service in one place or another, the hospital, the clinic, or the doctor's office, it should be relatively close and same. I don't disagree with that. They want to repeal harmful health policies enacted under the Obama and Biden administration, such as the Medicare Shared Savings Program and Inflation Reduction Act. Right. I told you that was in here. They want to base payments on the health status of the patient or intensity of the service rather than where the patient happens to receive that service. Do you hear what that says? They're going to hold the doctors responsible for whether or not a patient is compliant. And then they're going to penalize them if the patient doesn't do what he's asked them to. That's how I read that. Okay. I want to say Medicare Shared Savings Program. If you don't know that, that is a type of Medicaid pays and puts the buy-in for your Medicare premium back into a low-income person's check. But somehow it's harmful to people to have that assistance, that extra $174 a month going back into their check that's paid for with the Medicare Savings Program. It also, there's 3 different levels of that program, but none of them are harmful to low-income people who receive that benefit. It's not real. Medicare Part D reform. Government price controls will limit access to medications and reduce patient access to new medication. It must be opposite day is what I wrote, because that isn't true. All right, I'm going to go on. It says Medicaid over the past 45 years is failing some of the most vulnerable patients, is a prime target for waste, fraud, abuse, and is consuming more of state and federal budgets. I don't know how many of you know who Senator Rick Scott is. He is and holds the title of one of the biggest Medicaid and Medicare fraud convictions in the state of Florida, which is one of the most populated states. And he is now a senator. At the time, he was I think he was the governor over there, or he was something over there. And he is the one that they are. I think of that when they talk about how we're failing vulnerable patients. The truth is that there are more people enrolled now in ACA, Affordable Care Act, also known as Obamacare, and that there are more people who are on Medicaid than have ever been. And the largest user of Medicaid isn't necessarily in the blue states, although the state I live in is very, very large. But let's focus on the fact that most people on Medicaid are what I call working poor. And they are employed by Walmart and Target and, any McDonald's. And they pay them just enough money so that they can qualify. They don't pay them a livable wage. They pay them an unlivable wage. So the people have to get Medicare for their children, or Medicaid, excuse me, for their children. And then they have to get Medicaid, hopefully, for themselves. And they don't offer insurance. Now, I want you to realize that the Walton family who owns Walmart made $247 billion. I don't even know if you know conceivably how much money that is. I mean, it is... it's insane how much money that is. Nobody in that family will ever be able to spend that much money, but they can't afford to pay for insurance for the people that work for them. So when you go on the rolls for every state, you're going to discover that Walmart is one of the largest recipients of taxpayer-funded Medicaid that is available. And so are all the other companies that refuse to pay insurance. So when we talk about unionizing, unions are a good thing and they help people. And right now we are seeing some very severe rollbacks on unionizing and protecting workers' rights under the Department of Labor, which is not the subject we're talking about. But I just will mention that in Florida, they just passed a law. Ron DeSantis passed this law that said you you no longer have to offer people that work out in extreme heat breaks on a regular basis so that they can sustain themselves. So basically, they're taking away workers' rights. And then Starbucks is fighting tooth and nail with Jeff Bezos at Amazon, who builds buildings so that people can't afford to walk on their break. They can't even get to the bathroom in time to go to the bathroom and come back from a 15-minute break. Instead, they wear diapers at Amazon in those big, huge warehouses. They don't have enough bathrooms in the building. So why was that not OSHA in their face and in their business asking them to reconstruct the buildings that they were doing so that their employees didn't have to wear diapers to work? And the speed with which they require them to do their jobs is burning people out. I don't know. I mean, I think we're rolling back a lot of stuff here. Um, I'm done with CMS right now, except with Medicaid, they want to add a work requirement. Um, here's one. Here's one. So not what ACA was after. Okay. Medicaid recipients must go together as standard components in a safety net with the consumer choice, especially for able-bodied recipients. Medicaid recipients should be given both the freedom to choose their health plans and the responsibility to contribute to the health care costs at a level that is appropriate to protect the taxpayer. I'm sorry, I think we can all agree that we all need health insurance. And it may be time to start voting Democrat so that you can actually get universal health care and we can stop this nonsense. It would be much less costly for the entire country and the taxpayers if we did do that. I talked about, they want to add targeted time limits or lifetime caps on benefits to disincentivize permanent dependence. How about you make your corporations offer insurance instead of getting Medicaid on the dime of the taxpayer when they're making record-breaking profits, $257 billion for the Walmart family. Just saying. And they just say stuff that's just not true. It says most vulnerable and truly needy middle income to upper middle income Medicaid recipients. Medicaid isn't for upper middle income people. I mean, they want to protect it so those people can get Medicaid. They're not on Medicaid now. They can't afford. I mean, they have too much money in their home to qualify because it's needs based. It's based on the standard of need that the Federal Poverty Law Center has figured out and calculated based on household size, how many people in the home, how much money is in the home every month, gross income, and it isn't a upper middle income type of a program. So for them to say that is really, really insane. Move barriers to direct primary care. Revisit the No Surprises Act on surprise medical billing. I like that. Separate the subsidized ACA exchange market from the non-subsidized insurance market. Can't even, I mean, some of this stuff is so crazy. All right. So also underneath Center for Medicaid Services, there's a chapter called, I'm going to get you a drink of water. life, conscience, and bodily integrity. Prohibit abortion travel funding. Yep, federal law. Wants it to be federal law. The Hyde Amendment has long prohibited the use of Health and Human Services funds for elective abortions, but they say in August of 2022, Biden's executive order pressed the secretary, to use his authority under Section 1115 to waive certain provisions of the law in order to use taxpayer funds. There's no footnote, so I can't look it up. I would have to go and actually research that out myself. Maybe one of you wants to do that for me. But they're saying that travel is now being paid for federally. And I don't believe that that's true. I think Planned Parenthood pays for some of that, but they get half of their operating expenses from donations, not just from federal government. And they don't use federal government in Planned Parenthood, which also they have in this book that they want to completely close down. They don't understand that Planned Parenthood isn't just for abortions. It treats women in their pregnancies. It treats women, gives them screenings for breast and cervical cancer. It screens men for testicular cancer. It's not just for women, it's for men too. And they have all of these services that make up a huge percentage of it, and abortion is less than 3%. And then people talk about, oh my God, they're killing babies that are 9 months old. No, in very rare instances. And usually if a baby's brain hasn't developed, or they don't have a skull, or they're not going to survive outside the womb anyway, then they might do that in a third trimester. But it's not an option, and it hasn't been, even under Roe versus Wade, an option to just kill babies in the third trimester like they make you think that that's happening, and it's not. Yeah, okay, here we go. Prohibit Planned Parenthood from receiving funds, Medicaid funds, and then they talk about how the makeup of how they're made as. And again, no footnotes, so it's really hard to figure out if that's true. It says they need to defund them, and they said one of the 2 ways and actions they can do this to limit the funding is issue guidance reemphasizing states are free to defund Planned Parenthood and their state Medicaid plans. Proposed rulemaking to interpret the Medicaid statute to disqualify providers of elective abortion. Okay, so we won't do it to the parent or to the actual mother. Let's just make sure there are no doctors available, period. Congress should pass the Protecting Life and Taxpayers Act, which would accomplish the goal of defunding abortion providers such as Planned Parenthood. Then they go back on the last paragraph here, and they say abortion is not health care. States should be free to devise and implement programs that prioritize qualified providers that are not entangled with the abortion clinic industry. All right. They want to audit for the Hyde Amendment compliance. And the Hyde Amendment, there's the Weldon Amendment and the Hyde Amendment. And the Weldon, I think it has something to do with offering, if you require doctors to have abortion insurance, then that's a violation of the Weldon Amendment. And then I think the Hyde Amendment, take a full. Yeah, I'm sorry. I didn't read this well enough to be able to speak knowledgeably about it, so I'm sorry. Oh, it does. I did highlight this. It says permanently codify both the Hyde family of amendments and the protections provided by the Weldon Amendment. Congress can accomplish this through legislation such as the No Taxpayer Funding for Abortion and Abortion Insurance Full Disclosure Act, which is the Hyde Amendment, and the Conscious Protection Act. So that's like doctors saying, I don't want to I don't want to provide services to a woman that's in distress or having an abortion or a miscarriage. So that's the hide thing. So here's one that might upset transgender people or people that identify as binary. Under a proposed rule, sex is redefined. Discrimination on the basis of sex includes, but is not limited to, discrimination on the basis of sex stereotypes, sex characteristics, including intersex traits, pregnancy or related conditions, sexual orientation, and gender identity. In other words, the department proposes to interpret Section 1557 as if it created special privileges for new classes of people defined in ways that are highly ideological and unscientific. The redefinition of sex to cover gender identity and sexual orientation and pregnancy to cover abortion should be reversed in all HHS and CMS programs as was done under the Trump administration. This includes the CHIP Act. The low-income families who rely on CHIP should not be coerced, pressured, or otherwise encouraged to embrace this ideologically motivated sexualization of children, which they aren't. Children come and tell you that they have an issue and a concern. It's not like anyone's promoting that idea. I can't even. It's just not even funny. Here's another one where it's the religious thing. No, I'm not even going to go into that. I'm sorry. It's just too much explanation beforehand. There is one thing I actually like in here, and that is the child support payment interactive smartphone application, where parents can pay through like Venmo or Cash App, and then it's recorded. It's, they can pay more frequently than once or twice a month, and they can give money on a regular basis. They can also keep track if they buy something that's outside the child support, like sneakers or a blanket or new bedding or whatever it is. And so I kind of think that's not such a bad idea, and it's helpful. And I think men or women, whoever has to pay the child support, actually feel better when they know that they're actually assisting that child. So that might not be a bad idea. I don't think it should be mandatory. I think that it should be an option for parents to use the Cash App or the Venmo or Zelle or whichever one you want to use. And then, I can also go on a tangent and say we shouldn't be monitoring everybody's. We need to continue to have cash in this country, but that's a whole other story. Okay. This is something they want to do. They want to use HMRE funding or grants to provide state-level high school education resources and curriculum on healthy marriages, sexual risk avoidance, and healthy relationships. Sex education? Well, I don't know why they took it out, but they say allow child welfare funding to be used for marriage and relationship education. Provide educational information on healthy marriage and relationships at Title X family planning clinics. Ensure proper assessments with enough time to access these programs. Protect faith-based grant recipients from religious liberty violations and maintain a biblically based social science reinforced definition of marriage and family. I want to read that again. Protect faith-based grant recipients from religious liberty violations and maintain a biblically based social science reinforced definition of marriage and family. Without any footnotes, without any proof, they're just saying all their families' forms involve higher levels of instability. The average length of same-sex marriages is half that of heterosexual marriages. I don't think that's true at all. I know many, many same-sex couples that have been married way longer than heterosexual couples. Financial stress or poverty and poor behavioral, psychological, and education outcomes. So if you're not in a nuclear family with a mom and a dad, then you're going to do poorly. Let's see where we're going. Oh, Office of Head Start. First sentence. Ready? Eliminate the Head Start program. It's fraught with scandal and abuse. It's done the exact opposite. The program should function to protect and educate minors, but it's done the exact opposite. In fact, approximately 1 in 4 grant recipients had incidents in which children were abused, left unsupervised, or released to an unauthorized person between October of 2015 and May of 2020. Well, it seems like... oh, I know. I did look that one up. It's footnote number 68. It's on page 482. And guess who wrote that fact? They wrote it as an opinion piece in the Heritage Foundation. So is it a fact or is it an opinion? Because they're making it a fact in this book when it was written as an opinion without a huge amount of weight over there. It's my belief. Oh boy. Restore Trump's religious and moral exemptions to the contraceptive mandate. This rule proposes to amend Trump-era final rules regarding religious and moral exemptions and accommodations for coverage of certain preventative services under the ACA. Preventative services include contraception, and it appears the proposed rule would change the existing regulations for religious and moral exemptions to the ACA's contraceptive mandate. There is no need for further rulemaking that curtails existing exemptions. So when you say they were only going to do Roe versus Wade at the Supreme Court, we said, several people that are on MSNBC said, oh, I think they're going after contraception too. Looks like they are. So how many rights have we talked about? And getting rid of Head Start completely when it's helped over 11 million, or is it, how many children did they say? Oh, with a budget of more than 11 billion, the program has helped, just how many people can you help for $11 billion? A lot. They want to withdraw Ryan White guidance, allowing funds to pay for cross-sex transition support. Eliminate the week after pill from the contraceptive mandate as a potential abortifacient. Like it's a close cousin, the abortion pill mifepristone. Ella is a progesterone blocker and can prevent a recently fertilized embryo from implanting in a woman's uterus. So they want to get rid of that ability for a woman to self-abort. Provide education and resources on early childhood health. Prioritize funding of home-based childcare, not universal daycare. Currently, only about half of U.S. preschoolers are on track for their development and ready for school, and more than 1 in 4 children who experience abuse or neglect are under 3 years old. I don't know. I don't see. There's a footnote there. I didn't look that one up, though. So I'm going to go to the Office of the Secretary now, just in the book. And I'm going to read you restrict the Health and Human Services ability to declare indefinite public health. I don't even know what time it is. Emergencies. Reinstate the sunset, securing updated necessary statutory evaluations timely. Investigate, expose, and remediate any instances in which HHS violated people's rights by colluding with big tech to censor dissenting opinions during COVID, colluding with abortion advocates and LGBT advocates to violate conscience protection laws and the Hyde Amendment. So here they have, under the Office of the Secretary, they have a paragraph called the Life Agenda. The Office of the Secretary should eliminate the HHS Reproductive Healthcare Access Task Force and install a pro-life task force to ensure that all of the department's divisions seek to use their authority to promote the life and health of women and their unborn children. Additionally, they should be known as the Department of Life. By explicitly rejecting the notion that abortion is healthcare, that's the third time I've come across that, and by restoring its mission statement under the strategic plan, and elsewhere to include furthering the health and well-being of all Americans from conception to natural death. And they make no allowances for rape or incest or for medically terminally fetuses in the womb. The family agenda. Secretary's anti-discrimination policy statements should never conflate sex with gender identity or sexual orientation. Rather, the secretary should proudly state that men and women are biological realities and are crucial to the advancement of life sciences and medical care, and that married men and women are the ideal natural family structure because all children have a right to be raised by the men and women who conceive them. There is more to this chapter. Not too much more, but there's a little bit more, and I might go through that, but I don't want to make you crazy. What do I want to say? I'm going to wind it up now. This is most of what they're planning in the Health and Human Services chapter. What chapter was that? It's page, within this book, it's page 449, chapter 14. It's about 50 pages long, and there's about, 5 pages of footnotes attached to that. I don't know if you can live with any of those things. I don't think I want to live with those things. And I think it's very confusing. I think not having universal health care is harmful for not just patients, but for doctors. We're not getting people going to medical school unless they're going to specialty schools. We don't have general practitioners or internists. We don't have family practitioners, doctors anymore. We're ending up with a nurse practitioner, which I'm sure there are many that are very, very good. But at this point, in the rural area that I live in, we are short of doctors when we don't have them, and there's no plan to really improve that I've been made aware of. It doesn't mean that there isn't one. I'm hoping there is. And I plan to do what I can to try and get doctors from overseas to be able to come over here. So I would leave you with Timothy Schneider. He's a Yale professor, and what he had to say on Ali Velshi the other day. Democracies are always vulnerable. Democracy is a moving and living organism, but it's generally an optimistic system of government. And what we see in this book is not optimistic. It's authoritative. It takes away your rights. It controls your body. And it's is an anathema to what our founding fathers had set up for our country. So, an educated population will make choices that are good for the majority of people. People can rule themselves and protect democracy, but they have to actually want to do those things. And so in order to do that, I need all of you to help out by talking to people, not from a place of I'm right and this is my view and you can't change my mind, but from maybe a place where you can maybe have some wiggle room. Start with a conversation where you're not certain about something and you want to talk to them and ask somebody that's currently a Republican, how can you vote for, what is it that makes you want to vote for Trump? And do you believe all the things that he's done? And I just can't, that's like 2 hours worth of stuff that he's done that's just criminal. So I need you to stand fast and be involved. I need you to go and talk to people. I need you to sign up for anything, or send an email to the Chavez County Dems Gmail. And then I also, in keeping with democracies are always vulnerable. The other 2 things that I want to say are, Trump went out on television 2 days ago, and he talked about he was going to deal with domestic terrorists or domestic enemies. I might ask you who that is, because that is what Hitler said about domestic enemies, and they turned out to be the Jews. And I think we can all agree that didn't work out well. He's clearly telling people that he's going on a revenge and a retribution tour if he's elected. So well, I don't want Trump elected. One of the things we can do to combat that, if he is elected, is to always elect Democrats into the House of Congress and the Senate. House of Representatives and the Senate. And so that means down ballot. And then, of course, there's no down ballot in this county for any Democrats, but I need people to vote for our representatives. There's 3 of them, and our current senator that's running, because they need the majority in those 2 houses to be able to prevent a lot of what may happen if Trump takes over. Which is, I'm not even, I can't even imagine it again. I think women won't let that happen. I think I just found out that I have not been actually recording. I don't know. I'm going to check. But anyway, thanks for joining me here. I'm going to post this. It wasn't live. And until I figure that out, I'll just do it where I'm recording, talking, and then sending it to you. So it's been an hour that I've been recording. Thanks for joining me here. Sarah MacArthur signing off. Go vote. Go register. Talk to your friends. Bye.